Hello, it's nice to meet you. My name is Dr. Andrews. Thank you so much for coming in today. I do appreciate it. As you know, we are conducting our research just for some physical examinations. So we're just going to dive straight into it. Can you please tell me your full name, your date of birth, and what month it is? Great. So you'll also note that I'm going to be taking some notes down on the computer. So if there's any questions that you would like answered, please ask. Okay, so it's going to start from your head, just roughly to your shoulders and your chest. Okay, so if you do feel uncomfortable at any time, please let me know. That's really important. So we're going to get started with your scalp and your head. So do you have any headaches or suffer from migraines or anything like that? Okay. And do you suffer from dandruff? Have you had any hair loss recently? Okay. Okay. So I'm just going to put on some gloves and I'm just going to have a feel of your hair and your head. Okay. So I'm just going through and feeling. Okay, now is there any tenderness there at all? Okay. Right. And what about here? Okay, good. And what about here? Perfect. Okay, so looking at your hair, and there doesn't seem to be any excess sebum. Okay, this means that there's no excess oil around here, and I don't see any lice in that either, which is great. Thank you. Nice. Headaches. Okay, perfect. So I am just looking at your overall skin texture right now, and I don't see any discoloration, any redness or swelling. Okay, and do you put sunscreen on? Okay, is that every day? Okay, so it is really important that you do put sunscreen on. It'd be better if you could go SPF 50, and you should be applying that it's recommended that it's every half an hour and about a teaspoon. Make sure it goes all over your face, any exposed areas, your neck, your arms, anything, okay? So I can't see any sun damage at the moment, but in time there might be to some level. I'm just going to have a feel around your face if that's okay. So I'm just going to come a little bit closer, and I'm just going to press around your areas here. Okay. around your jaw. If I do it on both sides here, is there any pain? Okay. And I'm just, if you just open up your mouth. Okay. And again. Alright. So I don't notice any clicking in there, which is great. And your jaw feels perfectly fine. Okay. So I'm just going to palpate your cheek now. Okay. And there's no tenderness there. There's a little bit of redness, but I can't see any eczema, acne, any dermatitis. Okay. And just on your forehead. Okay, perfect. Okay, so I'm going to have a look at your eyes now. There's going to be a number of different tests here. There's going to be following my finger, how many fingers I'm holding, and there's going to be a couple of lights. Don't be alarmed, they can be a little bit bright, but again, any discomfort, just let me know, okay? So I just need to come a little bit closer because I just want to have a look right in your eyes. Okay. Right. Okay. Okay. If you can just look up for me, and I'm just going to pull your eyelids down, just noting if there's any. If you're pale, and just on the other side. Do you take any iron supplements at all? You don't? Okay. They're looking nice and pink. Perfect. Okay. Now your eyes look symmetrical as well. Okay. So if you just keep looking, maybe if you just look at the house over here. I'm just having a sneaky little look. Okay, so I'm going to start off with one of the lights. It's not too bright. What I want to do is I just want to have a look at your pupil dilation, right? So just going to come straight in now. Great. And just on the other side. Wonderful. Okay. Now I'm just going to separate here, and I'll be looking for the direct and consensual. Okay. They're looking straight ahead for me. So direct, consensual, direct, consensual, direct, and consensual. Perfect. And just on the other side now. Direct, consensual, direct, and consensual, direct, sensual. Perfect, thank you. And just whilst we have that, if you can still look straight ahead for me, I'm just going to check the size of your pupils. Okay, so right. So they're sitting at about 3 that I can see, and just on this side. Okay, got about 3 millimeters as well. What I'm going to do now is I'm quickly going to do the swinging flashlight test. Just going to quickly swerve into your eye and back out. Swerve in and back out. So we're just going to swerve in and again and again and once more. Perfect. And just on the other side now. I'm going to go in and out, in and out, in and out. Perfect. Just let your eyes have a little bit of a rest from the light. So if you can cover up one eye for me, thank you. And I'm just going to hold up my hand and I want you to tell me how many fingers that I'm holding up, okay? Great. Perfect. Lovely, thank you. And just on your other eye now. Yep. Wonderful. Great. And how about now? That one was a little bit of a trick. So perfect. So what I'd like you to do now with both of your eyes is I want you to keep your head straight in a locked in position. And I'm just going to move my finger along and I'd like you just to follow it, okay? And can you tell me what shape that I'm going to form with my fingers? Perfect. And another one. Great. And just one more. Okay, I can do that again. Great, thank you. Okay, so I'm just going to take my other light now and I'm going to come up even closer and I'm just going to pull down your eyes and I'm going to ask you to look up in different directions, okay? I'm just going to pull this one down first, so it's going to be quite bright. Okay. Right, so if you can please look up for me. Okay. And look down. and look to the right. Perfect, thank you. And if you can just blink for me. Okay, great. So just on the other side now, we're going to do exactly the same thing. Pull that down, and I want you to look up for me. Okay. And look down. Right. And look to the right. And look to the left. Perfect. And again, if you can just blink for me. Perfect, thank you. Okay, so what I'd like you to do now is I want you to look at something at the back. And when I tell you to, if you can look to the light, okay? So if you look at the back for me, okay, and look at the light, great. And if you look back to the back of the wall, okay, keep looking and look at the light, great. Thank you. So there's just one more test I'd like to do with your eyes. It's exactly the same as following my finger, except for this time I'd like you to follow the light, just with both of your eyes this time. So it might be a little bit faster as well. Okay. Perfect. Down below. Perfect. You're doing a really good job, thank you. Perfect, thank you very much. There seems to be no lag at all in your eyesight. Your pupil dilations look great as well, which is perfect. It's definitely something that we like to see. Okay. Okay. So next I'm going to have a look at your nose and your sinuses. So have you had any surgery or anything like that on your face? Okay. So I'm just going to slightly massage your nose. I'm going to feel the bone and the cartilage. Okay. Alright. And have you had any cold recently, or do you have any trouble sleeping? Okay. Right. Okay. And what about your sense of smell? You think it's okay? Okay, we're going to test that as well. So I'm just going to hold one side of your nostril closed, and I'd like you to take a deep breath in for me. Okay, so nice deep breath. Okay, and just on the other side, deep breath. Okay, perfect. Okay, so I have three mysterious bottles here, okay? and I'm going to get you to close your eyes and you're going to tell me what they smell like. Okay? Okay. So if you can please smell this one first. Okay. Perfect. And what do you think that is? Okay. So, you think it is rose? Let's have a look. That's correct. Well done. And just another bottle now. And if you can smell this one. Great. And what do you think that smells like? Okay, let's have a look. Yep, it is mint. Well done. And just the last one now. If you can please take a whiff of that. A nice deep breath in and out. I think you already know that one straight away. Yeah. I think it's lavender as well. Let's have a look. Okay. Yep, lavender it is. Well done. So that was complete and successful. Perfect. Now I'm just going to have a quick look inside your nostrils. So if you can just tilt your head up for me. Perfect. And just going to have a little peek inside. Okay. Right, I don't see anything here. Okay, so that looks perfectly normal, nice and open, and I don't see any discoloration or discharge in there. Okay, so I'd like to have a look at your mouth now. Okay, so at the moment there doesn't seem to be any crustation around your lips. Have you had anything like a cold sore in your life? Right. Good. Okay, so I'm just going to get you to open up your mouth now, and I'm just going to use a tongue depressor, and I'm just going to have a look inside with the light. So if you can just open up your mouth for me. Okay. Alright. And looking at the roof of your mouth. So really I'm just looking for any ulcerations, again any discharge, and if you can lift up your tongue. Right. Okay. Good. And if you can just pull out your tongue. Good, so I'm just going to lay this on your tongue here and have a look. There's no discoloration on the tongue. I'm just going to have a little feel of it. And there's no tenderness there. Okay, good. And if you can please just go, ah. Okay, good, good, good. Right. That looks perfectly normal, and the back of the throat, there's no redness here either. Perfect, thank you. Your teeth also look nice and healthy. Okay, perfect. So what I'm going to do now is, although I have looked at your face, I'm still going to use a couple of different things. So I'm just going to use a Q-tip here, and I'm just going to softly braise it on your face. What I'd like you to do is I'd like you to close your eyes and tell me when the cotton touches your face. Okay, perfect. So if you'd just like to close your eyes for me. Okay. Great. Perfect. Lovely. Great. And perfect. Thank you very much. And I have another test here. I have a brush side and I have a blunt side. So I'd like you to tell me when it's the blunt side and when it's the normal side, okay? Great. Perfect. Blunt, correct. Great. Perfect. Perfect. Great. Thank you very much. That's great. You can now open up your eyes again. Now I'm just going to feel around your neck, okay? So I'm going to look around the lymph nodes to see if there's any masses that might be there. Your lymph nodes might be hovered over just a little bit. That just indicates you maybe have a sore throat or you might be coming down with a cold, okay? So just looking at glands and things like that. Okay, so I'm just going to have a look. Okay. Perfect. Okay, so I don't feel any lumps or masses, any bumps. How does that feel? Good. And how about here? Good. So I'm just going to feel underneath. Okay. And I'm just going to hold onto your trachea, and if you can just swallow for me. Okay, good. Just feeling around that again. Perfect. Muscles. Do you get any neck pain at all? Okay. Do you go on a computer a lot? Looking at your phone a lot? Okay. So it's very good to look into massage if that's what you're doing all the time. Because that's going to give you a little bit of relief. I'm just going to note down that you do have some pain. And a computer. Okay. Alright. So, you just want to make sure that your posture is nice and straight up too. If you are looking at a phone, maybe look at it from a distance. Not looking down all the time, or you really are straining especially the back of your neck. Okay. Okay. So I'm just going to quickly feel around your temples. Okay. Okay. Is there any discomfort there? Nope. And what about just above your eyebrows? If I press here. Nothing. Okay, perfect. So I'm just going to have a look now at your facial expressions. So if you can give me a really nice smile for me, show me all those teeth. Okay, good. And I want you to frown for me. Great. And if you can raise your eyebrows as high as I can. Great. And now frown for me. Yes, a really mean frown. Good. Thank you very much. So what I'm going to do now is I'm just going to put a bit of pressure onto your jaw, and I'm going to try and push it, and if you can resist. Okay. Okay, good. And just on the other side. Perfect. Thank you very much. So I'm going to have a look at your ears now. Do you wear any implants or any hearing loss or anything like that recently? Fullness? Nope. Okay. So I'm just going to have a look first on the outer ear. So I'm just going to yeah, I'm just going to have a look. Okay. Let's have a look at the outer ear first. Palpating around here. Okay. Now, does that hurt at all when I press on here? Okay. And just on the other side, just going to palpate around here. Great. And any pain here when I pull this back? Okay, perfect. So what I'm going to do now is I'm just going to look inside with my scope, and this gives me a little bit of a clearer look inside your eardrum, and if there's anything on there. So I'm just going to have a look first. Okay, so I can see the eardrum, and it looks pretty clear. You have some wax in there, which is good. It doesn't look impacted. Okay, it doesn't very clear. Okay, perfect. Remove that one and have a look in the other. Okay. So I'm just going to pop this in here. Okay. And I'm having a deeper look inside now. Right, the edge. Okay, and a little bit deeper. Perfect. Okay. And there seems to be no discharge in this one either. Okay, perfect. So we'll just dispose of that one now. Okay, so I'm just going to have a little bit more of a look with my light. Okay, so I'm just going to just go to the right side first, okay, and I'm just gonna have a look. Okay. How does that feel? I do Perfect. And I'm just going to have a look on to the other side now, so please just look. Again, how does that feel? Okay. Perfect. Thank you very much. Please, no discomfort at all. Okay, so what I'm going to do now is I'm just going to whisper a couple of numbers into your ear, and if you can just repeat them after me, okay? Alright, so I'm just going to go over here. So if you can please 2, 5, 7, 6, 0. Perfect. And just on the other side. 10, 0, 20, 2, 100. Perfect, thank you. Now, can you hear this? And when does it go away? Okay, and can you hear it back now? Okay, perfect. And the same with this. When can you stop hearing it? Perfect. And again on the way there. Okay, perfect. So your ears look completely fine and intact. Okay, so just with your shoulders now, I just want you to lift them up and pull them back down. Lift them up again and pull them back down. Perfect. So if you lift them up now, I'm just going to place my hands on your shoulders and I want you to try and resist me from putting it down. Okay? Okay. Perfect. Thank you. And again. Great. Thank you. And can I just have a quick look at your fingers? Okay, no discoloration, blood forms back in the fingernails. Perfect, thank you. And can you just do that for me? Yep, as fast as you can. Okay, and if you just go like that as fast as you can. Okay, and if you can please just do that. Great. Okay, so that looks great. Okay, so the last couple of things I'm going to do is I just need to have a listen to your heart. Okay. So I just want you to take in very deep breaths, okay? Nice deep breath in and back out, and a nice deep breath in again and back out and back in and back in and back out. Perfect. Thank you. So I'm just going to have a listen to your heart rate now. Okay. Okay. Okay, so bubble, 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 bubble. Okay, perfect. Your heart rate is sounding nice and clear. There is no rhythm deficiencies or anything like that. It all sounds very clear. Your breathing sounds clear, which is lovely. Your lungs feel nice and clear. Okay, perfect. So just one last thing is I just want to check your blood pressure. I'm just going to wrap this up around your arm. And just attaching. Okay. Okay. 2, 3. And again. Okay, perfect. Thank you very much. Perfect. You can pop your arm back there. Your blood pressure is nice, static. Perfect. Alright, so I think I have everything here to conclude our examination today. What you will do is that you will get an email with everything that I've noted down today, and then we'll keep it for our research purposes along with everybody else that we do the examination on, okay? Perfect. Thank you very much for coming in again. I appreciate it, and hopefully we can do another examination on you soon.